Hi, you're watching Pikai Pharmacy. So today in this video we're going to learn about the mechanism of action of antifungal drugs. But before starting, I want to tell you that all the definitions of important keywords are all given in the description below. So please check out for that. Now, as we are going to learn about the ways in which antifungal drugs act against fungus, so we should know a little bit about fungus. So what is fungus? So fungus are a group of heterotrophic, non-photosynthetic eukaryotic organisms like yeast, molds, and the popularly known mushrooms. So they are classified separately under the kingdom fungi, and they possess chitin in their cell wall that adds up to their unique characteristics. So now let's jump on to the mode of action of antifungal drugs. Fungal infections are difficult to treat, particularly in the immunocompromised patients. There are several drugs that act in several pathways to eliminate such fungal infections. So the objective of antifungal drug is to kill this fungal cell. So most of the fungal drug do this by altering the cell membrane permeability. However, there are drugs that kill the fungal cell by blocking the nucleic acid synthesis and disrupting the microtubules. So let's first discuss about those drugs that kills the fungal cell by altering the cell membrane permeability. So here is the fungal cell wall and the cell membrane that I have drawn in details here. So the outward represents the fungal cell wall and the inner portion represents the cell membrane. The fungal cell wall is composed of proteins. So these are the proteins you can see, and below the proteins occurs beta glucans. So beta glucans are nothing but polysaccharides of glucose. So these are the beta glucans. Now below the beta glucans comes the chitin. So chitin is very unique to the fungal cell wall. So it is actually made up of polymers of N-acetylglucosamine. So this is the usual bilipid fungal cell membrane. But what makes the kingdom fungi unique is the presence of a special kind of sterol known as ergosterol. The cell membrane also consists of beta-glucan synthase enzyme that helps in the production of beta-glucans, which is present in the fungal cell wall. So antifungal drugs that alters the cell membrane permeability does it by inhibiting the synthesis of ergosterol or by binding to it. So the synthesis of ergosterol starts from squalene. So it is converted to 2,3-oxidosqualene by the help of the enzyme known as squalene epoxidase. Then it is converted to lanosterol. So this 2,3-oxidosqualene is converted to lanosterol. Then it is converted to ergosterol by the help of the enzyme known as demethylase. In order to kill the fungal cell, the antifungal drug needs to stop the synthesis of ergosterol. So the first step is the conversion of squalene to 2,3-oxidosqualene. So it is done by the enzyme squalene epoxidase. So terbinafines are a group of drugs that inhibits this enzyme and stops the production of 2,3-oxidosqualene. Thus it inhibits the production of ergosterol also. So the final step, that is the conversion of lanosterol to ergosterol, is done by the enzyme known as demethylase. So demethylase helps in the conversion of lanosterol to ergosterol. But azoles are the group of drugs that inhibits the demethylase enzyme in order to inhibit the synthesis of ergosterol. So here are some examples of azole drugs. So these are the azole drugs that inhibits the demethylase enzyme in order to inhibit the synthesis of ergosterol. So these are fluconazole, itraconazole, ketonazole and miconazoles. Not all drug inhibits the synthesis of ergosterol. Rather, they bind with ergosterol to show their effect. So there is a drug known as amphotericin B that binds with the ergosterol in the fungal cell membrane and creates pores in the cell membrane, and from those pores the cell content leaks out, causing death of the fungal cell. Now there are some drugs which blocks the synthesis of beta-glucans which is present in the fungal cell wall by inhibiting the beta-glucan synthase enzyme which is present in the fungal cell membrane. The beta-glucan synthase is responsible for the production of beta-glucan in the fungal cell wall. So by inhibiting it can stop the production of beta-glucan, thus causing alteration in the permeability of the fungal cell membrane, thus causing death of the fungal cell. Example of such drug is echinocandins that inhibits the beta-glucan synthase enzyme. So now let's discuss about those antifungal drugs which kills the fungal cell by blocking the nucleic acid synthesis. Example of such drug is flucytosine. So flucytosine kills the fungal cell by inhibiting the nucleic acid synthesis. So now at last there is another drug known as griseofulvin that kills the fungal cell by disrupting the microtubules of the fungal cell. So it all wraps it up how antifungal drug act against the fungal infections. Thanks for watching. I hope you like this video. Subscribe to this channel. Stay healthy. Bye.